Hi, everyone, and welcome to today's The Impact of COVID-19 on Working Parents, Childcare, and Gender Equity webinar. I'm Javon Dominica Fua, and I'm coming to you from Boston, where I am the Assistant Director of Educational Initiatives at the Office of Alumni Relations at Northeastern. I'm excited to have with us this afternoon a few special guests, faculty member Dr. Alicia Sasser Modestino, New York City Community Leader, alum Bill Lee, DMSB 07, and Demetrios Katos from the College of Social Sciences and Humanities. Before we begin, I want to share some Zoom practices and announcements. We'll be recording this event and we'll upload the recording to the Alumni YouTube channel within the next few business days. Participation in this event means you consent to being recorded. For optimal viewing, we suggest selecting the speaker view in the top right corner of the Zoom meeting. While we ask you to remain muted during the event, we do encourage you to type your questions in the chat for the Q&A session, which will be at the end of the webinar. Now I'll turn it over to Bill.
Thank you. Thank you. And welcome, everybody. This is going to be a great conversation, certainly something that has impacted a lot of people in the last year, where our day-to-day lives have completely flipped on our heads as a result of this global pandemic. A little bit about myself. I've been involved with the alumni community here in New York City for over 10 years. One of the impacts that we have had is that, alumni events have almost all been in person, and in-person events have been completely eliminated. Now we're doing everything by Zoom. But what a great way to be able to connect the community, not just in New York, but also across the country and world, and be able to, better connect with the university and with the Boston area and events like this. I know Alicia Sasser Modestino is going to be a professor, will be sharing with us some great insights that's affecting everybody, both in the workplace and in the home. And hopefully maybe we can get some synergy from the speakers today, as well, from our guests today as well, in the Q&A later. But without further ado, I'd like to turn it over to Professor Alicia Sasser Modestino.
Great, thanks, Bill. I'm just going to share my screen here, pull up some slides. Okay, so you may have heard us economists calling the current economic downturn a she-cession, and this is for two reasons. So first, women are more likely to work in occupations and industries that have been hit hard by the pandemic. So in-person jobs and service, even healthcare, education services. And second, the shutdowns and reduced capacities at daycares this past spring, coupled with a school year filled with remote and hybrid learning, has created an unprecedented disruption to the nation's childcare system. And the consequences of that fall disproportionately on women. So with support from the provost office, myself and two other faculty members here at Northeastern, Jamie Ladge in the DeMoore McKim School of Business and Elisa Lincoln in the Bouvet College of Health Sciences, formed an interdisciplinary research team to determine how much of the she-cession was due to lack of work versus lack of childcare, and what were the impacts on parental well-being. While part of this motivation was purely scientific, I have to confess that two of us were also living it. I have 4 kids ranging in age from 8 to 20. Jamie has 5. And at the time we started this work, we had 2 competing hypotheses. Will this unanticipated shock to work and caregiving set women back a generation, which was the title of an op-ed that I wrote in the Washington Post this past July? Or would it enlighten society so that caregiving gets shared more equally between men and women, which is a nod to Jamie's recent book entitled Maternal Optimism. So you can see we had both sides of the coin there. So first, let me give you the landscape here in terms of what was happening with women before the pandemic and what has happened since then. So back in January 2020, just prior to the pandemic, there was an interesting milestone in the jobs report from the Labor Department. 95% of the net jobs added in December 2019 went to women, such that women by January had just held over half of all payroll jobs in America for only the second time in history. The first time this happened, you can see in this graph here, right, is essentially where that dotted line crosses there in 2010, was during the Great Recession. And that was when there was a wave of layoffs that hit male workers first, and that temporarily gave women an edge in the workplace. And that period was even dubbed the man-cession. And before long, though, women were hit with their own layoffs, and so that advantage didn't last for very long. At the start of 2020, so if you can see at the far right of that graph there, that's again where those lines are crossing, we begin to see again women exceeding men in terms of the number who are working. And at the time, the thinking was that this could be different because women's gains were coming from being hired at a faster pace than men, not just suffering fewer job losses. And economists were making these bold predictions that women would continue to outnumber men in the workforce, particularly since the share of women with a college degree had also just surpassed that of men for the first time in 2019. The other thing economists were excited about was that, you know, the long-running evolution away from these male-dominated industries like manufacturing and toward the service side of the economy was where women had an edge, right? So hospitality had added 40,000 jobs in December 2019. Women were holding 77% of the jobs in healthcare and education. These were fast-growing fields that really eclipsed any of the goods-producing sector of the economy that we had seen before. Little do we know that while women would retain their human capital advantage in terms of earning college degrees, their employment prospects would plummet just 2 months later. To look like this, right? So you see that cliff that's happening towards the far right-hand side of this chart. What happened was, you know, during COVID-19, it was unlike anything that we had seen since the Great Depression. And for the first time in decades, the recession really had a female face. So women accounted for 55% of the 20 million jobs that were lost in April 2020. And that raised the unemployment rate for adult women to about 15% from the 3% that we saw in February of 2020. And this was the first time since 1948 that female unemployment had reached double digits. The biggest reason for these losses, of course, was that the industries that were hardest hit by the pandemic in leisure, hospitality, education, and even some parts of healthcare were disproportionately female. So these are jobs in restaurants, hotels, tourism, travel, childcare, any kinds of personal services. Jobs that are in person, so there's no chance for remote work. And these jobs also did not snap right back when states reopened because of capacity restrictions, bankruptcies, or even just a lack of demand from consumers who are already skittish and financially struggling. As with health disparities, the economic disruption caused by the pandemic has meant that, in particular, women of color have fared much worse than white women. So unemployment rates for Black women ranged from about 16% and Hispanic women about 20%. In January 2021, almost 1 million fewer Black women were employed compared to February of 2020. That's a decrease of 9.5% since the pandemic began. The losses in local and state government, leisure, and hospitality have disproportionate impacts on Black women. Black women were nearly 1 in 4 public sector workers and 1 in 8 leisure and hospitality workers. And it's not like these trends are going to easily reverse themselves compared to what we've seen in the past. So even that period I told you during the Great Recession, it took about a decade for Black women's employment to recover from the Great Recession. And now almost all of those hard-won gains have been erased. The other thing that we're particularly concerned about as economists is women's labor force participation rate. So this is different from employment. This is whether or not you are even seeking a job. In January 2021, another 275,000 women dropped out of the labor force, meaning they were no longer looking for work. And that accounted for nearly 80% of all workers over the age of 20 who left the workforce that month. That brings the total number of women who have left the labor force since February of 2020 to more than 2.3 million, and it puts women's labor force participation rate at 57%, which is the lowest it's been since 1988. Again, the steepest decline, that top blue line there you can see, has been among Black women, with 500,000 Black women just completely leaving the labor market since January 2020. And these women are not included in those unemployment numbers that I was telling you before, and that's because to be counted as unemployed, you have to be looking for work. So those who have left the labor force are no longer looking, they're no longer working or looking for work. So in some ways, the unemployment rate is really an artificially lowered statistic because it doesn't capture these millions of workers who have left the labor force. So why are so many women leaving the labor force? Many of these women have been forced to leave the workplace due to ongoing closures of schools and daycare centers. If you learn nothing from today, I want you to remember the phrase that childcare is infrastructure. enables parents to get to work just like roads and bridges do for commuters. And if you read the New York Times today or other coverage in the Wall Street Journal about Biden's infrastructure package, part one is roads and bridges. Part two includes childcare. And this is not an accident. I wrote a paper over the summer for the Federal Emergency Management Administration talking about critical industries and in particular childcare and the role that it plays in the economic recovery. And so we have since passed that report on to the Council of Economic Advisors. And I was really gratified to see that childcare has been included in the Biden infrastructure plan. And this is because the obstacles that childcare imposes on workers, as we've seen during the COVID-19 crisis, are widespread. They're not limited to just a few key industries or geographies. A lot of families who are able to find short-term solutions during the initial round of daycare and school closures by reducing hours, taking paid or unpaid leave, alternating schedules with another adult in their household, were stopgap measures, right? And these things are just not sustainable, especially when you face an entire school year of remote and hybrid learning. And remember that elementary school is not just education, but it is also a form of free publicly provided childcare. And the longer that this childcare crisis continues, it's likely that more parents, primarily women, will need to drop out of the labor force to care for children. So a full economic recovery simply cannot happen without adequate childcare. Now, childcare is an important concern for a significant portion of the US workforce. So about a third of the workforce, or 50 million workers, have a child under the age of 14 in their household. Of these workers, about 30% have a child under the age of 6, requiring the most supervision. Prior to the pandemic, about 60% of children under age 5 participated in regular weekly care with a non-parental provider, either paid or unpaid. Childcare facilities were the most likely type of childcare that was provided. But even there, only about a third or so of childcare facilities are those big centers that you think of. Most of them are small family provided daycares that are sole proprietors. Other types of care is that provided by relatives, so grandparents, aunts, uncles, siblings. And then school, of course, becomes the most prevalent arrangement for kids that are ages 5 to 14. But even then, 10% of all school-age children are participating in one or more forms of organized childcare, such as that provided by childcare centers or after-school programs or things like that. The other thing to note is that the use of paid childcare varies a lot by state. So this is a map showing you the percentage of kids age 0 to 5 that are in non-parental care for more than 10 hours a week. And the dark blue shaded states like Massachusetts are places where we see childcare being used at a higher rate. So this ranges from, a low of 33% or so in Nevada to a high of 70% in Massachusetts. Organized childcare also plays a really important role in the economy. It boosts employment and stimulates consumer spending. In 2016, childcare firms employed about 1 million workers, with a typical provider employing about 12 workers or so. Estimates have shown that the childcare industry's economic impact in states like New Hampshire is about 7% of GDP, which is about the same as hospitality and tourism. So it is not a small part of the economy. At the same time, pay in the industry remains very low. So the average employee in a childcare center is earning about $20,000 a year, and about half of those workers are on some kind of public assistance. Now, what happened in April 2020, in that little box you can see there on the left-hand side, was that among working parents who reported needing care during that time, nearly 2/3 had difficulty finding any kind of care, including a third who found it very difficult. And that was double to what had been reported 6 months earlier. So I also want to make the point that it's not like childcare was wildly abundant or affordable before the pandemic. In fact, there are a lot of studies that show in many states that the annual cost of daycare exceeds the annual cost of attending public university. So just let that sink into a moment, that parents would be paying more for childcare in a year than they would to send one of their kids to college in their state. And every daycare center has wait lists. It's not like you can walk in and the next day sign your kid up, right? So we had a childcare crisis going into this. Now we have a full-on, pull the fire alarm emergency going on. Childcare provides a service that's essential for working parents, particularly women. And we see this because there's a strong positive correlation between women's labor force participation rate, meaning the share of women who are even looking for work or are employed, and the share of children who are in paid care. And so that's why in states like Massachusetts that have both higher rates of female labor force participation and higher rates of childcare usage, this makes it all the more critical to expand childcare as the economy reopens. Yet, we know that the US stands in contrast to a lot of other developed countries where the labor force participation rates of women with children, even in Massachusetts, are lower. And a lot of researchers have linked this to care not being available or affordable. At the latest jobs report, we know that women are making up just over half of the unemployed, but account for 80% of people dropping out of the labor market, leading us to speculate, the role that childcare plays. And then just to nail this home even further, studies have been done that have showed that even before the pandemic, the burden of childcare typically falls disproportionately on women when their family can't find or afford childcare. So this was a study done by the Center for American Progress that looked at what happens when families are looking for care and they don't find it. So the blue bars there are when families find affordable daycare. The light blue bars are when they don't. And you can see on the far right there is fathers' employment rates, pretty much unchanged whether or not families find or do not find childcare. Look at moms' employment rates on the left-hand side, right? Big disparities, big drop off where women are filling the gap there if their family can't find childcare. The disruption that was caused by the pandemic has really raised a lot of new concerns about the long-term viability of the childcare industry and the subsequent consequences for childcare workers, parents, and children. So in the childcare industry, we saw closures, plummeting enrollments, enormous losses of revenue. Most of these are home-based facilities. Like I said, they could not access the Paycheck Protection Program. So for example, only about half of childcare providers were able to apply for a PPP loan. Of those, only half got it. And of those who got it, they only got about $100,000, and it didn't go very far. So for example, I asked my daughter's daycare provider to show me their financial situation. And according to what she said, she went from earning, on net about $50,000 a month to a loss of about $50,000 a month. And that was even with a PPP loan. And that's because we cut the number of kids that they could serve in half, and yet she still had to employ the same number of staff. And then on top of that, she has to pay for extra cleaning. And on top of that, she has to pay for extra toys because, as my daughter says, during COVID times, not sharing is caring, right? So we can't have kids exchanging lots of toys and things like that. For childcare workers, right? We saw between March and April, 350,000 childcare workers who are largely women lost their jobs. And we've seen just under a third of those jobs having been recovered. And given that these were very low wage workers to start with, it's not like they had lots of savings to be able to get through this period. And then for parents, right, we mentioned the difficulty in trying to find care and that, this became even more difficult than we had seen before. And then finally, it doesn't get talked a lot, but children, the effect on children has also been quite profound. And even in Massachusetts, there was a survey that showed 84% of parents said they were worried that my child's missing out on important developmental opportunities, meaning mostly socialization and learning, while daycares have been closed. And I would say this even extends more towards the elementary and even in the upper grades, right, where we've seen an increase in suicide, depression, eating disorders among teenagers who haven't been able to go to school. So what did we do? So our study started off with conducting a national panel survey, ironically between Mother's Day and Father's Day this year. That's just the way the timing worked. We really wanted to be able to study this disruption caused by COVID-19 with regards to how this sudden shock to childcare was going to affect working parents, and more importantly, what policies and practices could ameliorate these impacts. So we looked at everything from how the division of labor shifted between working moms and dads. Did they experience a different change in work status during the pandemic? How often was this lack of childcare associated with those changes in work status? And that turned out to be a really critical question because there's no other survey out there still that's asking people, if you lost your job or reduced your hours, was it because of childcare? Lots of people infer that women who have kids who have lost their job, it was because childcare. I just showed you there's a She-cession going on. So there's lots of reasons why women are losing their jobs. We're the only study that can tell you why. Then we also looked at the health and well-being of moms and dads during this period, and then what public policies or employer practices would make a difference. And then also how this varied by race, income, and level of education. Not surprisingly, women significantly increased the time that they spent on schoolwork and playing with children, as well as cooking and cleaning, compared to men who only marginally increased their time on these household tasks. What is this chart showing you? So the blue bars are for men, the orange bars are for women. The hatched parts of the bar are for what the hours that people were spending per week pre-pandemic. The shaded parts of the bar shows the increase during the pandemic. And you can see those bars are growing more among women than they are for men, except maybe for TV and a few other categories like that. I'm not going to even comment there. The other thing is, our survey also confirms the trends that we've seen during this She-cession. And this is important to validate our study, right? So we made sure that our national sample of parents, 2,500 working parents across the country, it's balanced in terms of race and gender, level of education and income, but we didn't know what it would look like in terms of people's labor market impacts. And we're showing the same kinds of trends, right? That women were much more likely to suffer any job loss. They were much more likely to be laid off or furloughed at the time they had been expecting to be recalled. We have a follow-up survey out in the field right now that's capturing whether or not they actually were recalled. And a lot of this, again, was driven by women being more likely to work in those in-person industries like hospitality and tourism and childcare and things like that. The other thing that we found that's really been something that's gotten a lot of media attention is that nearly 20% of working parents reported either having lost a job or reduced their hours solely due to childcare. And so we gave them lots of reasons to tell us why they lost their job. Their company went out of business, their company laid off staff, there was no remote work available. They themselves lost their business or they lost their gig work. And then childcare was a separate response that was chosen by nearly 20% of the parents. Again, this fell disproportionately on women, and in particular, women who became unemployed. And to some, it might not seem quite obvious, like how can you get fired from your job because of childcare? These are people who went and asked, right, for schedules that could accommodate their childcare situation, and they were denied, right? And so when you have an in-person job and you have no childcare, you can either leave your kid at home alone or you can go to work. And clearly, working moms have no good choices. I think a lot of people talk about women opting out of the labor market or opting out of the job market. Women aren't opting out, they're being pushed out. There are just no good choices here. Working parents are losing on average 11 hours a week due to childcare. This was similar in magnitude to the hours that people were losing due to staff reductions, loss of business, or lack of remote work available. That says to me that childcare is as important a factor as all of these other economic reasons. And it's a fixable one, right? If we actually made the investment. Again, women of color, those without a college degree, those living in low-income households lost more hours per week. And again, this is in part due to their greater likelihood of having to work at an in-person job. And overall among our survey respondents, only 50% of women versus 70% of men could actually work from home during the pandemic. This figure is probably the most disturbing to me. We asked, what are the factors that affect how you divide up caregiving responsibilities in your household? We gave them lots of choices, as you can see here. The most likely ones that were chosen are the ones that I would have expected. So 40% or so are citing, it depends on which person was currently employed. So if you lost a job, clearly you're getting tagged with the childcare. Which person works more hours, which person has a more flexible work schedule. But the fourth most likely choice was which person's better at taking care of the kids. Now, to be honest, I only included this, for like completeness. I really didn't think anyone was going to pick this. And I certainly didn't think they were going to pick this ahead of saying which person earns more income or which person is more at risk of being laid off. And that, says to me that I think a lot of our gender roles, our traditional gender roles, are still very active in the household decision-making that's going on. And then, finally, one of the other things that we looked at was, the well-being of moms and dads. Obviously, both moms and dads are experiencing high levels of distress 2/3 are scoring in the range of high psychological distress during this period, according to a mental health scale that we used. One of the things I want to highlight is that this is not all about women. So if you look at that little table there that has the parental stress scale, men are actually suffering higher rates of parental stress. Why? What is going on? So we actually interviewed about 75 or so individuals, 17 couples. And what we found was for the first time, men were having to adopt what I'll call the mom brain, where you're on a Zoom call, then you're making lunch for the kids, then you're on a Zoom call, then you got to help them with their remote work, then you're on a Zoom call, then you got to take them on a bike ride. And men were just throwing up their hands like, this is insane. How do you do this? Women have been doing it for a long time, so maybe we've developed that multitasking ability to some extent. Men were finding this really difficult to deal with, as well as trying to make sure that they were still working as many hours. For women, women were worrying actually more about working hours, and that's because it's a she-cession, so they're trying to hold on to their jobs. Women were also sleeping a lot less, and they also were facing a greater sense of uncertainty about when things would return to normal. And I think a lot of that was driven by what was happening with schools. We also looked at how many parents had any kind of backup during the pandemic. It was only about 30% or so. And this varied a lot by high versus low income households. So high income households are those dark green bars there. Low income households are the light green bars. You can see a big difference in terms of having any backup care. The high income households were more likely to be using a nanny, a former daycare person. So this was a big thing that I heard about where, daycare would shut down and high income households would grab some of the workers out of there. They're relying on friends and all sorts of other backups. The only category where low income households exceeded high income households was in grandparents, which sounds, great on the face of it, except for the fact that this pandemic is much more dangerous for elderly individuals. And so the fact that low income households are having to rely on grandparents as a source of care during this time is a little bit disturbing. And then finally, we looked at, what was going on in terms of the workplace policies and practices that were occurring at this time. I think one of the things that was most disturbing to me was that about 24% of working parents reported they had paid leave available to them at their employer. Only 4% had used it. Now, this is something we see all the time where people are very reluctant to use paid leave. And that's because they're worried about they don't look as committed to the organization. They're worried about retaliation. But during this pandemic, like if you can't use paid leave during a pandemic, I don't know when you can use paid leave, which really, maybe has to make us rethink about any kind of paid leave policies that are going to come online following this. In terms of workplace practices, allowing parents to work from home was very common. Again, not everybody gets access to that. Backup childcare subsidies were very common. So providing extra days through care.com, which, helpful, but again, we're way beyond backup care. This is everyday care, right? So giving me an extra 5 days of care.com is, better than nothing, but it's not going to help me for the long term over this year. So finally, putting my researcher hat on here, and you don't have to think too hard about this, we wanted to know what was the impact of these policies and practices on having to either leave your job or have your hours reduced because of childcare. So we ran a regression analysis, and the highlighted things that are there with the stars are the things that were statistically significant that made a difference. So for example, for women who are experiencing job loss, if they had access to paid leave through their employer, that minus 39.4% shows that it made them much less likely to leave their job or to report that the reason for their job change is childcare. Also, if they had coworker support, right? So if they had a team that they were working with who could help them get through this. Also, if they were allowed to work from home, that was wildly impactful. In terms of reducing hours, having some kind of access to the backup childcare that does fill in, right, a couple of those hours during the day for that remote learning, or having your manager support. So, one tweet that I saw on Twitter was a manager who had a woman come and ask him, I need to cut my hours because I can't balance, the work with what's going on with my family. And he said, no, you can't do that. And I thought, gee, what a jerk. And then I read the rest of the thread and he said, no, I'm not going to let you do that. That's what women do. we work as a team. We're going to fill in those hours with you. And then a year from now, when we're back to normal and somebody else is having a family crisis, you're going to work more for them. So that's the kind of managerial support we're talking about here. Also, having some kind of childcare subsidy to be able to help pay for this, hugely helpful in terms of not having to suffer a reduction in hours. And then finally, I'll just say that, working parents who identify as Black or Hispanic are just much less likely to get any of these benefits, either in terms of paid family leave, even sick time, as well as any of these, special COVID things like backup childcare subsidies or pay under quarantine and things like that. So these things are not being distributed equitably. Now, in terms of public policy effort, what we saw initially during 2020 fell far short of what we needed. So we had the Families First Coronavirus Response Act. Wonderful. It actually established a national paid leave policy. Did any of you know that? Probably not many did, because it wasn't widely talked about. And also you had to access it through your employer. So if your employer didn't tell you how to apply for it, there's really no way for you to get to this. Second, the Paycheck Protection Program, lots of issues with small businesses being able to access this. Well, sole proprietorships that are childcare providers are the smallest small business you can find that are the least equipped to apply for these. And so I told you they had incredible difficulty applying and getting these loans. And then finally, the CARES Act back in March, right? Our first big wave of COVID stimulus provided about $3.5 billion for the childcare industry, which sounds great, except then you realize it's less than each one of the major airlines got in terms of a bailout. And so that's why I have the kids there with a plane taking off in the distance, because no one's flying, but we all need childcare. And so that just fell way short, which then put the pressure on the Biden administration when they came in to pass a package that was actually going to deal with this. And so they did do some things that's going to provide some relief to parents and childcare providers, but it falls a little bit short. So for parents, we get an expansion in the child tax credit that's going to help us pay for some of this extra care that was unanticipated, particularly if you had elementary school kids. No one's expecting to be paying full time for care during this year. Sets a higher limit on the child care dependent tax credit. All of this is good if you pay taxes, if you qualify for that. If you're low income and this is not a refundable tax credit, this does not help you. For child care providers, this is where they really made the childcare industry whole. So this was great. They gave $15 billion for that child development block grant, because the first $3.5 billion only gave about $2,000 for only daycares that actually were serving low-income kids, right? So it really didn't go very far. They're providing $1 billion for Head Start, and then $24 billion as a stabilization fund for childcare providers. So basically carving out a part of the PPP just for childcare providers, which is desperately needed. What's still missing? Paid leave for people who are experiencing temporary but ongoing caregiving needs, right? So setting up the childcare system, great. Kids are still not back in school. So parents who are losing their sanity right now, some of them need to take paid leave, and we're not providing them any way to do that. And then why go back to normal? Let's go back to better. So let's provide subsidies that make care affordable for households beyond just the neediest and pay childcare workers what they're worth. So, employers are not off the hook here either. And some employers have been doing better than others. A lot of the major employers, they threw up the childcare subsidies. Some that aren't even covered on this list are like IBM, which gave several months of vacation to all their employees. If you're a parent and you need to take off every afternoon to take care of your kids, use that vacation time. If you don't have kids and you're suffering high burnout from the amount of work that you have to do, find another way to take that time off. But here's a drastically expanded vacation period. Use it how you need it. And then that picture there on the right-hand side is a small company that realized that they had not as many kids that needed supervision as parents who needed to work. And so they flipped the office. You drop your kid off at the office, they socially distance them and supervise them during remote learning. You go back home and work in peace. That sounds great to me right now, as I have 2 kids remote learning in the next room. And then finally, it remains to be seen whether workplaces are going to go back to normal or back to better, right? So we have the CEO, Reed Hastings there from Netflix, saying there's no positives to remote work. Everybody needs to be in the office. We have Dana Kennedy, right, from Simon & Schuster on the right-hand side there saying, hey, we're all grown-ups. We know how to work from home. I really don't see why we all have to come into the office. and then everything in between there that's recognized on this slide. So we do have a follow-up study that we're going to be doing a longitudinal interview process as workers go through this reentry for anyone who's been working remote over the past year to see what are you able to negotiate with your employer? Because right now, none of them are talking about childcare. They're talking about health and safety and what's productive, but they're not talking about the needs of their employees who have kids or other caregiving responsibilities. Okay, so that's my talk. Happy to take any questions. We'll see what came in during the chat, but thank you so much.
Great, thank you so much, Alicia. This was fantastic. What a rich presentation. We do have a number of questions and that have already been submitted by the participants when they registered. So I'll start with some of those. So first question, could you say a little bit more about, you've already addressed some of the industries that were impacted by the She-cession. Do you feel that there's anything else that you need to add in terms of, where the impact has been felt outside of hospitality and daycare industries?
Yeah, so I think, initially what people also didn't realize was that healthcare was impacted, right? So a lot of healthcare shut down, except for the most essential part of healthcare last spring. A lot of that has come back, but we did see a wave of retirements and closures among, small physician practices, pediatricians who decided to retire at this point. So not everybody in healthcare is back to work. Most of it has been in hospitality and tourism, but also think about other personal services like hair salons, nail salons, any kind of personal service that you can think of, as well as not just childcare providers, but also ancillary school workers, right? So people who worked in after school programs and things like that. And I think, one of the other interesting components of this has been, the debate between childcare and school-aged kids, right? So I've often seen people talk about what's the difference between a 4-year-old and a 5-year-old. A 4-year-old has been able to go to school in person for this past year, and a 5-year-old has not, right? So even though we have limited capacity in the daycares, they have been open, and those workers have been told to go to work, compared to in the K through 12 system, where we have a different situation. And whether or not you think, teachers should be in school or not, or the safety of it, the fact that these two parts of what is essentially still education, right? We call childcare workers early childhood education workers. They're part of the education system. They're part of child development. Speaks volumes about how we pay and how we employ and how we treat those workers when they are not unionized. So there's a whole other range of issues that's related to the She-cession that's going on there as well.
Thank you so much. I'll try to organize the questions in terms of, what you've already presented and what some of the implications are. So another question that came in through the chat was, do you have any data for the impact on single parent homes?
Yeah, that's a great question. So that didn't make it into my slide deck, but we have seen that there's a greater propensity for women to leave the workforce when they are single parents. So it's about a 7 percentage point difference between whether or not you are married, as well as it's a greater propensity among Black women in particular as well. So definitely family type makes a difference, and the resources that you have available, right? Because single parents, there is no other partner to share those duties with. And so then it becomes even more important for you to be able to have any kind of supports outside the home.
Thank you. What about, one of the participants had asked upon registration, why aren't we talking more about how pay inequity made it easier for women to step out in the first place? And I know that you had a slide that addressed sort of, the amount that people were making, but I wondered if you can address that a little bit further. Yeah,
it's really interesting. It's a whole host of factors. So I think that would have been my prior, was that, women are earning less. And so they're going to be the ones who are going to be expected to step away from their jobs. Although if you look among married couples, there's a rising proportion of women who are the breadwinners. So it's not, across the board anymore that women are the secondary earners. And that slide that I show you, that is a consideration that's in there. But I think that what was more damaging was that aside from pay, right, who's better at taking care of the kids was a factor. And I think that's one thing, to note, that while the impact has been greater on low-income women, right, who maybe aren't earning as much as their partners, we do see this up and down the income spectrum, right? So we've not only heard about, home health aides and nurses having to leave their jobs. We're hearing about surgeons leaving their jobs, right? We're hearing about public health epidemiologists leaving their jobs during a pandemic, right? You're seeing companies like, the hospitals in the Boston region banding together to be able to pay for childcare, to expand the childcare benefit. Because right now we need every healthcare worker at work, right? We can't afford to have childcare interrupting that. So one of the benefits, for example, that they provided early on in the pandemic was not, just this, here's 5 extra days of care.com. They just gave their workers money and they said, pay whoever, pay your neighbor, pay your mother, pay an older sibling of the child, just get to work because we need you right now. So, I think, and because of that, I think because we've seen it cut across, income and education and occupations, people are finally realizing that, yes, childcare is a piece of critical infrastructure that we need to do something about. So I hope that we have this, little window of time to be able to emphasize that and be able to set up a better system than what we had before. Oh, you're muted, Demetrios.
Sorry about that.
That's classic.
Another question from a registrant. What does this mean for mental health access and insurance coverage for women?
That's really interesting. So the mental health needs are huge, and they're huge across the board. So that's like another thing I think people don't realize is that parents are suffering, right? We measured that. We didn't measure what's going on in the household with the kids, but I can tell you, not just from what's in my household, but what I've seen presented in my kids' school around suicide prevention webinars, eating disorder webinars, anxiety and depression webinars, that the kids are not all right either, right? And so the parents are expected to address the kids' mental health issues without, first putting the mask over your own face and dealing with whatever's going on in your stretch of the world. And so, it really depends on what people's healthcare coverage, how it's structured, right? So if you were the breadwinner or you were the one who had better health benefits that included mental health benefits, and your job loss then means that you've lost those health benefits, then it's much more difficult, right, for people to be able to get any mental health care, aside from the fact that there's a huge shortage right now in terms of even being able to make an appointment virtually or not with a mental health care provider. And then again, if you are a single parent, you are it, right? And so if you've lost your job because you've had this really just impossible choice between going to work or caring for your kid at home, then you've lost that benefit. And, again, that just places a greater burden on those parents.
Thank you so much. Some of the other questions were a little bit more forward-looking. So what do you think is the future for equal pay following the pandemic?
Yeah, well, if we go back to Jamie and I's dueling hypotheses there, I don't want to say I'm winning because winning is not a good thing in this case, but I do really worry. I do still think my op-ed from July stands up that, we're seeing this pandemic setting women back a generation where they're taking on more of the caregiving. Some of the factors are if they're better taking care of the kids, they're not only, reducing their hours, but they're leaving the labor market, right? If we see anyone leaving the labor market, we know it's so much more difficult to get back into it, particularly for both the top and the bottom, right? So at the bottom of the labor market, low-wage individuals, typically need to retrain, right? I don't think we're going to see restaurants coming back at the same capacity that we had them in the next 6 months or a year. And that means people have been out of work for 2 years in that sector. And so trying to retrain is not easy. And then at the top of the income distribution, when a surgeon quits their position, they lose their hospital administrating positions, admission privileges, sorry. They lose, their client base, they lose their patient base. Their skills are diminished over time. And so it's not that easy to just jump back in and out of the labor market. So I really do think that we're going to see pay equity decline over the next several years until we can get women back to work, until we can make sure that caregiving is something that falls squarely on both parents' shoulders for reasons that don't have anything to do with gender.
Thank you. I encourage people to put more questions in the chat. We do have a few more questions here, but if you have any questions for Professor Modestino, please feel free. So you mentioned slightly what kind of investments you envision being made in order to support what you're calling childcare infrastructure. Would you like to elaborate on those investments, and do you want to put a dollar figure on it?
Yeah, well, I can take the safe way out because there already was a dollar figure that was put on it. About this time last year, economists came together and signed a letter, including myself, that said we needed $50 billion to shore up the childcare industry. We got $3.5 billion in the first CARES package. And then in the second package under President Trump in December, we got another, 30 billion, I believe. And so this 15 billion that that Biden just provided rounds us out to that 50. So we got what we asked for eventually. It feels a little late, frankly. I do worry about how many childcares have closed permanently. There was an estimate that we were going to lose 420,000 childcare slots permanently if we didn't shore up the system. And that was an estimate from this time last year. We know that we only recently got showered with all of this money to be able to help daycares stay afloat. And again, those are things, I think people forget about the adjustment costs here. That one daycare goes out of business, that doesn't mean another one takes its place overnight, right? So these are longer term deficits that we're going to face for several years. So, other things that I've been thinking about going forward have been, for example, providing more professionalization, if you will, of the childcare sector. So we have a lot of family home daycare providers, which I think have often been overlooked, but they've actually been the backbone of the childcare system. And if you think about it, during a pandemic, that's exactly the kind of care you want. You want that small little bubble. You don't want a giant childcare center, right? That's mixing a lot of kids together. And yet we don't really support those workers at all. Those workers are actually making less than the ones in the daycare center. And so if we provide, I've talked to the city of Boston and those at the state level about providing, additional training and certification for home daycare providers to professionalize that line of work so that we can, provide some subsidy to those in-home daycares and make them more prevalent. The other thing is that a lot of Black and brown families live in childcare deserts. What is a childcare desert? That basically means you live in a neighborhood where there is no childcare anywhere nearby, right? And it's really hard to, especially if you think about in dense urban neighborhoods like Dorchester and Roxbury, to drop a giant childcare center in there. You could have lots of family home daycare providers there that provide jobs, right? That then have provided childcare for other people to get to jobs, and that childcare is provided nearby. So that's one thing. Another thing that I've thought a lot about is the idea of making childcare a benefit like healthcare is a benefit. So we all pay into healthcare plans, right? We all pay into a pool of money because the idea is that we are ensuring the risk that all of us will eventually have to address, right? So at some point I am going to get sick and need to draw on that benefit. At some point you are going to get sick and need to draw on that benefit. Childcare or caregiving in general is no different. I think people think, but not everybody has kids. Well, if you expand it to be thinking about caregiving, we all have an elderly parent. We all have spouses. We all have relatives who could potentially become disabled, or children who will need caregiving at one point or another. And that's how state plans work, like the one that just went into effect in January 2021 in Massachusetts, where we are all paying into a fund that can be used to be able to pay for some kind of caregiving need down the road. So I think we need to see more of that. We need to see employers recognizing that that's a benefit to their employees and to recognize that a lot of this work in the past was invisible and done by women or not paid for very well. And so recognizing that this is valued work that we need to pay for and that it needs to be more equally distributed is going to be key going forward.
Thank you. As a follow-up question to what you think should be government investment, what about private sector investment? I think you just alluded to that a little bit. And then a follow-up question to both of those, how is it to be paid for?
Yeah, so private sector investment, you know, employers found the will to pay for healthcare because it made their employees more productive. So there's already estimates that, you know, we're losing on average $56 billion a year due to a lack of childcare. And those estimates come from the fact of when people have to miss work because their childcare falls through. People can't get to work or even find a job because they don't have reliable daycare. So if you think about that $50 billion investment that I just said all the economists wanted, that's completely counterbalanced, right, by the $56 billion loss we see every year from not having adequate childcare. And where does this, you know, does this actually happen in practice in the real world? Can we see it? Yeah, you can't, because during the pandemic, you've seen Toyota and other big companies setting up remote learning centers near their production facilities. Why are they doing that? Out of the goodness of their heart? No, because they're realizing that absenteeism because of childcare is really, really costly. And how can they make sure that their employees can get to work? By providing childcare. And why is that? Because it's critical infrastructure, right? That lets people get to work. So, so I think some of it is going to come in terms of paying for it. You know, some of it is going to come from, you know, reductions in the lost productivity that we typically see. Other parts of it are just going to have to be subsidized, particularly for low-income workers. And we're going to have to realize that this is very similar to subsidizing healthcare. So, you know, as an economist, I think we have to be incredibly transparent that stuff is costly, right? Healthcare is costly. I think one of the probably misnomers of the ACA when Obama was passing it was that this was going to pay for itself over time because of efficiencies that were going to happen from providing people with preventive care. That hasn't really been realized. And I don't think any health economist really thought that it was going to pay for itself in that way, particularly. But, you know, you don't just do things because they pay for themselves. You do them because they're right and because they create a more equitable and just landscape for workers. So, so I think part of it's going to be, you know, there will be some cost savings, and then part of it will just be having to pay for stuff that's been invisible before.
Thank you. We have two last questions, which I think we can squeeze in. The first is from one of our participating members. With all these shifts, can you negotiate salary if you have a job offer or trying to get promoted? And then the last one is, what's next with this research?
Yeah, so the labor market's a little tricky right now. There are jobs that are in high demand. So it depends if you're in one of those sectors, right? So if you're a respiratory therapist who's been on the front lines of COVID, we can't find enough of you. Or if you're someone who is in IT, that's probably another really hot job right now. If you are in logistics, if you're a logistician, which I don't even know what that was at first, but that's basically the people that Amazon hire to get stuff from here to there, you're a hot job. So yeah, if you're in demand and employers are looking to hire you, my advice to all of my students is always ask for more. Well, do your homework first. Know it is a reasonable ask, right? So get on Glassdoor or whatever it is. Always ask for more and be prepared to have them say no, right? So the worst that can happen is they come back and say, no, you have to take the salary that we've offered. And you say, thank you very much. When do I start? If you're not in one of those kinds of hot jobs and you're just lucky to get a job in a field, you know, if you're a restaurant worker getting a job right now, you don't really have a lot of negotiating power. One of the things we will be studying going forward is, can you negotiate other things, right? So as we think about workers re-entering the physical space, so for all of us who have been Zooming from home forever, eventually we will be going back to public spaces. I know for the university, we will be going back in the fall. Will it be 5 days a week? Maybe not, but it will be several days a week. And so one of the things that we're doing is working with the Massachusetts Competitiveness Partnership to think about how to advise employers of the things to think about, right? And then also to follow employees over time and see what can they negotiate with their employer, right? So you do have negotiating power with your employer to say, I need to be at work these 3 days because that's the way my kid's hybrid schedule works. And then what can you negotiate on the home front with your spouse or your partner or whoever it is that you share caregiving duties with? Because these two things are where the rubber meets the road.
Fantastic. Thank you so much. I really appreciate the responses to the questions. I think we've covered just about all the questions that we had here, and we're coming up on time. So, Jovan?
Yes, thank you very much to Dr. Modestino, Bill, and Dimitrios for helping lead this webinar with me today. Thanks as well to each of you for joining us. You'll be receiving a survey email that will include the slides, and you'll be able to share your feedback. You can also include future event suggestions and let us know if you want to get involved with your local Northeastern community as a volunteer. Keep in touch with the Office of Alumni Relations to achieve what's next.